In this video, let's learn about the important features or landmarks in the middle cranial fossa. Now these landmarks or features are commonly asked as spotters as well as questions during viva or discussion. So let's begin the video. To begin with, we have the sulcus chiasmaticus, which is a horizontal groove forming the anterior boundary of pituitary fossa. Importance of sulcus chiasmaticus is it is related to optic chiasma. Remember an important point. Sulcus chiasmaticus will not lodge the optic chiasma. Optic chiasma is just related and present above the sulcus chiasmaticus. The posterior limit of the sulcus chiasmaticus shows an elevation, and this elevation is referred to as the tuberculum sellae. Tuberculum sellae gives attachment to the diaphragma sellae. Then, behind the tuberculum sellae, we have the pituitary fossa, or commonly referred to as hypophyseal fossa. As the name suggests, this lodges the pituitary gland. Then we have the dorsum sellae, which again gives attachment to diaphragma sellae. On either side of sulcus chiasmaticus, we can see the opening of optic canal. This is the optic canal. Optic canal allows for the passage of optic nerve and central artery of retina. Then the anterior clinoid process. The anterior clinoid process will give attachment to the tentorium cerebelli. Next, this is the blunted posterior clinoid process, and this will give attachment to the tentorium cerebelli again. Now, on either side of the pituitary fossa, we can see a groove. This groove is referred to as the carotid artery groove. This lodges the terminal portion of internal carotid artery. The next important landmark we can identify is the superior orbital fissure. This is the superior orbital fissure. The superior orbital fissure is divided into three parts: superolateral, intermediate, and then inferomedial. Superolateral compartment will allow for the passage of structures which can be remembered by the mnemonic L, F, T. L stands for lacrimal nerve, F for frontal nerve, and T for trochlear nerve. Apart from these three nerves, we also have recurrent meningeal branch of ophthalmic artery, superior ophthalmic vein. The intermediate compartment will allow for the passage of superior and inferior division of oculomotor nerve, nasociliary nerve, and abducent nerve, whereas the inferomedial compartment will give passage for inferior ophthalmic vein. The next important landmark we can identify is the foramen rotundum. Foramen rotundum will allow for the passage of maxillary nerve. Then the next important landmark is the foramen ovale. Foramen ovale allows for passage of structures which can be remembered by the mnemonic MALE. M stands for roots of mandibular nerve, A stands for accessory meningeal artery, L stands for lesser petrosal nerve, and E stands for emissary vein. Along with this, it will also allow for the passage of anterior division of middle meningeal sinus. The next important landmark is the foramen spinosum. Foramen spinosum allows for the passage of nervus spinosus, which is a branch of trunk of the mandibular nerve, and then middle meningeal artery. The next landmark is the groove for middle meningeal artery. We can see that the groove for middle meningeal artery begins from the foramen spinosum. As the name suggests, this lodges the middle meningeal artery and middle meningeal sinus. The next important landmark in the middle cranial fossa is the foramen lacerum. Now, foramen lacerum will allow for the passage of internal carotid artery. An important anatomical feature of foramen lacerum is, in living, the lower part of foramen lacerum is closed by cartilage, whereas the upper end is only open. Apart from that, we can also see the petrous temporal bone. The next important landmark is, we can see the depression for the trigeminal ganglion, and as the name suggests, this will lodge the trigeminal ganglion. This will be converted into the trigeminal cave or Meckel's cave by the dural folds. To quickly summarize, this is the sulcus chiasmaticus, tuberculum, sellae, hypophyseal fossa, dorsum sellae, optic, canal. Then we have the superior orbital. Then we have the superior orbital fissure. Then the anterior clinoid process, posterior clinoid process, carotid artery, groove, optic, canal, the superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, groove for the middle meningeal artery and middle meningeal sinus, the trigeminal depression for trigeminal ganglion. Thanks for watching regarding the important landmarks of middle cranial fossa. Thanks for watching. If you like the video, please leave a like, comment, share and subscribe. Thank you.